visiting with Dr. Bradley Meyer, always trying to help us out, but bring us some hope as well. That seems to be one of the things that people are really clamoring for these days.
Amen.
Yeah.
Absolutely, Dave. Glad to be here again. Happy to share some, some good hope stories, specifically on the concussion front. This is an area where we often miss things as far as treatment in the traditional realm. From a perspective of making sure that you don't have something more significant like a brain bleed with a CAT scan, those kinds of things, and a really good neurologic workup that often happens in the emergency room. All that can be very important. But after that, when that stuff's been ruled out and you're hanging with some brain fog and a headache and irritability, maybe some insomnia, all that stuff tends to be traditionally the modus operandum is just to say rest, which that's not wrong. Not wrong at all. But there's more to do for it, and a lot more.
Yeah, and one of the things that normal recipe for concussion recovery is make sure you're easy on the eyes. Try not to have a lot of eye activity, right? Like don't do much on screen time,
Correct.
Things like that.
Absolutely.
Right. So, interestingly, and we'll get to some of the other people that you've treated, but so first of all, it's important that people get diagnosed properly. That's very important. One of the things that's really important, and I'm glad the state is doing this now, but in high school athletics, there's a protocol now for the kids to go back into activities. And there's a lot of kids that get sidelined with concussions, and then they have to be cleared before they can get back out there. But you have found through treatment, other than just rest, you can maybe get them out there a little quicker.
A lot quicker.
Yeah.
Yeah, it's accelerated healing. So specifically, so you can come in to Okoboji Wellness Clinic just for a simple consultation to have a potential concussion evaluated, and then we can determine if hyperbarics is right for you. And what happens with a concussion, you've got that soft tissue, that brain tissue inside that fixed space, which is your skull, and you have a coup counter coup is called type of reaction. If you're in a whiplash, you don't even have to pass out. If you just whiplash in a motor vehicle accident, for instance, or you hit your head against a cabinet, something as simple as that is causing that brain to rock back and forth quite a bit. And that causes a whole lot of trauma, inflammation, neuroinflammation to that brain tissue. Time, again, helps resolve that. But when you go into the hyperbaric environment, which is increased atmospheric pressure, you are helping with the neuroinflammation. So you're literally helping bring down all of the chaos that's going on in that brain. And so you can have as little as one hyperbaric treatment, and folks will get out after a week of symptoms and before they sometimes come into the clinic, and it's a dramatic change. It literally, you think of it as a wounding condition. Hyperbarics treat wounding conditions. And that's why I encourage everybody to call the clinic and see if your condition, chronic disease, inflammation, wounding conditions, right for you. So there's so many wounding conditions out there, including a lot of chronic pain and so much more that can be treated with hyperbaric therapy. But the brain is wounded acutely with a concussion, and by throwing in this hyperbaric condition, increased oxygen pressure, that inflammation is reduced. It's turning on genetic expression. So this is a really delicate, beautiful process. It's not as simple as most people think. You go into this environment and literally you're increasing voltage within the cellular membrane, allows the body to go in and heal itself. and it's turning on over 8,000 different genes, organic gene therapy again, which is that genetic expression. And so often that with these anti-inflammatory genes getting turned on is just shortening that recovery time. It's absolutely incredible. So we can get people back to activity much faster. And this is why you see a lot of the professional teams are starting to do hyperbaric therapy for performance in sports, to optimize sports performance, but also for recovery. A lot of Michael Phelps is a swimmer. The Cubs have hyperbaric therapies in their clubhouse. So it's becoming more mainstream, and everybody that has a concussion, the first thing they should think about is, I need to get some hyperbaric therapy, because long term, if you don't get hyperbaric therapy, you can get post-concussion syndrome, which can last for months on end, and it can turn into permanent. You can have an increased risk for dementia, and you can have increased risk for decreased cognitive processing. So it's almost like your brain does not process as quickly. That can become more of a permanent condition if that's not treated in the acute phase, because inflammation can then turn to scarring. We don't want it to get to the scarring phase. That's why it's so critical. Everybody, and that's how you shout it out on the mountaintops. It is such good news that every doctor, every patient, every person should know about this. So if you have a loved one that hits their noggin, think hyperbaric.
Well, speaking of loved one, my wife, this is not a secret, was in an automobile accident. She's got a tremendous healthcare provider, and she diagnosed her properly with concussion issues. And I noticed that as the days went on, that she was just a little off. And of course, we had been visiting with you about hyperbarics, and why not give it a shot, and because she's pretty tough, but she had just crazy headaches, bad headaches, crazy burning in her neck, and she was just having a really tough time with this concussion. And so I believe she went over to see you 6 days post-accident. Incredibly significant headaches, incredibly burning down her neck. And I want to be cautious here, because I'm sure results vary by patient. But she went in, and one treatment, the headaches and the burning down her neck were gone. Right.
And hyperbarics, from a length to see benefit with treatment can vary but when you're talking more acute conditions, whether it's a sprained ankle or head trauma, it's not uncommon to see a quick response like that. So those are really exciting, because it's literally like a light switch is turned on.
Right. And so, I mean, what a relief. What a relief to go from, well, I'm not right, to, wow, I feel good. I can go live again.
Right.
Yeah.
It's huge.
It's a huge deal. And you have had people with the concussion situation. You have had people for dementia, those type of things. And the success stories are not limited, and they continue to be told. And one of the reasons that we know now about hyperbarics especially is because they used it to treat our military people.
Right. Traumatic brain injury for a lot of those roadside IEDs that would explode, those blast injuries. Huge. And that's the last 10 to 15 years that's come about, where we're seeing that being utilized more and more, and the evidence in the research is confirming that it is a significant response that the troops are seeing that are battling depression, oftentimes after traumatic brain injury. And it's never too late for these folks. That's the thing. It's like some folks that even from the Vietnam era that had a blast injury can still see benefit this many years out with hyperbaric therapy.
Yeah. And we should be really quick, if we can, explain, because people think, well, hyperbaric therapy. Okay, well, let's if we can, talk about, okay, they're talking about this. What is that? It's pretty simple.
Pretty simple. And so you come in for a consultation, and we make sure it's right for you. We review your medical history, your medications, and in most cases, it's right for you, and it's going to provide, in most cases, some significant benefit. So, it is a pressurized environment that we will have you. It almost looks like a tent, an ice shack. It's a mild pressure chamber, and we've got an amazing nursing staff that will facilitate your care, make sure it's a comfortable process. We give you a pillow and a blanket. Many times people take a nap in there while we increase that pressure in the chamber through an air compressor to 1.3 atmospheres, or about 10 feet underwater. And you might have a little bit of ear pressure, just like flying. Similar type of sensation, but it's a really relaxing experience. It's a white glove service that not many people, in the Iowa, Minnesota, upper Midwest area are doing hyperbarics from a medical perspective, where we've got a high level medical team surrounding you through this process. So it's very safe and very enjoyable. So it's about an 80-minute encounter from start to finish, where you're in there. You can read a book or just take the best nap of your life.
There you go. All right. So if anybody wants to find out more, of course, they can go to OkobojiWellnessClinic.com, or they can give you a call and tell folks how they can find you.
Absolutely. Yep. OkobojiWellnessClinic.com, 712-339-6024. And we have one plug for a big week coming up. We've got a open house next week, right after Memorial Day weekend, June 1st. It'll be Thursday from 4 to 7 p.m. Come on out. We've got the entire building now, and so we've expanded. There's a lot of services that we have to offer, and we really love to have you come on out, check us out, and see what we're all about.
Very good. And that's Thursday, 4 to 7?
Not this Thursday,
right,
but the following.
Yep, next
Thursday.
June
1st.
Next Thursday, 4 to 7. Do check it out. It's a phenomenal facility. Dr. Meyer, thanks.
Thanks, Dave.
Thank you very much. Dr. Bradley Meyer with Okoboji Wellness Clinic. Again, OkobojiWellnessClinic.com.